Golf is a passion. In the words of Phil Mickelson, I think it's more than whether or not you win or lose. It's having that opportunity on the final round, final 9, to come down the stretch with a chance to win. I'm Brock Huard. Like many of the things we love to do, golf can lead to chronic or recurring pain in our backs, knees, and other joints. Thankfully, for those of you with chronic pain like me, I'm here today with Dr. Daniel Nelson from Eastside Pain and Regenerative Medicine. We're going to discuss the many minimally invasive therapies and leading-edge technologies available to help stop the pain so you can keep doing what you love. So good to see you, Dr. Nelson. What is a patient-centered treatment plan?
Well, patient-centered treatment plan means that the patient is basically in control for the most part. I'm there as their advisor and trying to go through the menu of what's going to help them to get to where they need to be.
And how much input do they have? I was telling you a story before we started about one of my old teammates who met a doctor, and it was a little bit more about what the player wanted than the doctor. But how much input do they have in these meetings with you?
Well, it's an interesting conversation because I'm trying to, as the medical expert, give them advice to achieving what they want. But it's important, especially in things like pain medicine or pain management, to hear what they have to say, because we don't really have an x-ray or lab test for pain, but we have to go by what they tell us. So it's an interesting conversation for sure.
And as someone who's lived with a little bit of pain, played a sport that induced a fair amount of pain, how do you get to the root of that pain? And because your age group that you work with is all across the board.
Yeah.
And they come in the door with all varying degrees of pain. So how do you get to the root of their pain?
Well, the first conversation is talking to the patient. We call that the history. We hear what they have to say. We want to hear the story of their pain and how they got there, what they're doing on any given day. What is the pain interfering with? What we call the ADLs, activities of daily living. Is it interfering with what they are doing around the house or in the garden or in the kitchen or golfing? And is it interfering with their sleep pattern? That's an important thing that we're asking. So that also directs where we go, where we focus on. They tell us where the pain is, what the pain pattern is, and then we start in from there.
And you've been doing this for over 3 decades.
Correct.
Years and years, and one of the longest tenure when it comes to pain in this area. I'm going to guess the imaging, the tools that you have to work with are a little better today than they were 30 years ago?
Oh, absolutely. Technology continues to advance, and it's important to keep up with that technology. We have some fabulous tools at our disposal, but also the fact that the most important piece of the equipment is what's between the ears, right? So you can have the best equipment or technology available, but you also need that clinical expertise and experience and know what works and what doesn't work.
We were chatting before we started. Baseball players love to get judged, and you judge young talent by how many tools they have. Oh, this is a 5-tool player. We get around the NFL draft, and does this guy check every box and he's got all these tools? What tools do you have? When I walk in the door and I've got pain, what tools do you have at your disposal?
Right. Well, I'm not sure we have enough time to go through the whole toolbox, but we have a number of tools, and what's important is finding out what the tool is that's appropriate for any given patient. You know, there's this saying out there, if all you have is a hammer in your hand, the whole world looks like a nail. We don't want that. We want to use the appropriate tool for whatever's bothering you, whatever's pain is in your life. And it comes with experience.
What do those tens of thousands of operations and the work you've done on spines and every body part over your 30 years, when I walk in the door, how does that benefit me as a patient for your 30 years and those thousands and thousands of hours on the job?
Well, it's just kind of like that expertise. It's like flying with a pilot who's spent 30 years flying an airplane. You just have that expertise and that comfort of knowing what's going to work. Now, it's still, important to listen to the patient, because every story is unique. Mm-hmm. And so it's important to hear the story, but also in the back of my mind, I'm always thinking, okay, where is this going to lead to? What's the treatment plan, the diagnostic plan first, but also the treatment plan. So that's a conversation that's going on between me and the patient. As I'm hearing things, I'm thinking in the back of my mind, what kind of things do I have diagnostically, but also in the therapeutic toolbox to bring to bear.
You know, in our market, we've heard a lot with our athletes over the years. We have coaches and managers that are pretty open and pretty transparent, and we've heard words like stem cell and regenerative treatment and those things. And stem cell in particular probably gets the most fanfare, right? The most headlines. In some ways, it's almost a controversial term. How much stem cell do you do?
Well, I do a fair amount. It's a tool in the toolbox, and again, it's finding out what's appropriate for that patient and whether that's an appropriate conversation. It has been remarkable, I will say. I've been doing stem cell injection therapy for things like knee pain and arthritis in the shoulders for about 7 years now. And I was most skeptical before I started doing it, but I started seeing the results. My very first patient was an MD, and I was at a clinic that was doing it, and at that point I was, like I said, skeptical, but the results kind of spoke for themselves. The stem cell thing is controversial,
Why?
no question, because it's a loaded term. Back in the 90s, we had the kind of controversies with embryonic stem cell research. That's a non-issue. We do not use embryonic stem cells. We use your own stem cells coming out of your own body. All we're doing is taking stem cells, in most cases, out of your bone marrow where you have plenty. I tell patients, look, your stem cells are working fine or you wouldn't be sitting here talking to me. So we're taking them out of your bone marrow and concentrating them, putting them to work in your knee or your shoulder, wherever it is. But it's important to be able to do that technology in a precise and thoughtful way.
And what kind of recovery time? If I get a stem cell procedure, am I out months? Am I out, right? How quickly do those stem cells help facilitate, just growth and pain-free step and process?
So the beauty of it is the downtime, the recovery time is minimal. Most patients are back to routine activity within a week. So compare a stem cell treatment of, say, a shoulder, which, you're back to your routine activities within a week, maybe 10 days at most. Now a shoulder surgery, and I don't know if you ever had shoulder surgery.
Thankfully, no.
That's a big recovery time.
Yeah.
We're talking 3 months minimum, sometimes 6 months. A total shoulder replacement, 6 months out of your life minimum. So there's a world of difference between stem cell therapy versus invasive surgery in comparison.
You were asking me when we were playing golf what I miss most about playing. And I said to you, it's just the camaraderie, right? It's just that team. It's what every former player says. At your clinic, it really is a team environment. You guys don't sit in your own silos just doing your own thing. There really is a team aspect to what you guys do. Why?
Well, it's just critical to have that team approach where I'm relying on people. And that's where you have to have the humility to know that it's not all about me. I have other critical people in my practice that do very important jobs, or else it doesn't get done. So, and I've had people, my medical assistant's been with me 15 years. That's almost unheard of, actually, in the real world. So my physician assistants will be with me 10 years as of next month. So it's important to have that team, as you know, having that cohesiveness of working with a team that's been together and kind of knows what each person is thinking almost. So that's a big piece of our success.
And I'm going to guess with 30 years of experience, it's more than just clients and patients that knock on your door. I'm going to guess it's peers. I'm going to guess it's young doctors. When you're a fellow as you are, and this has been your profession for 30 years, how much do you enjoy passing on that knowledge and teaching some of those up-and-comers?
Well, I enjoy it immensely. I have medical students, residents, and other practicing physicians come through my office on a regular basis. And I've been invited to be a guest lecturer at the University of Washington on multiple occasions. I just enjoy doing that. And I also think it kind of keeps you sharp.
And when we're done golfing and my back is barking, how do I come see you?
So the easiest way is go to eastsidepain.com, and you can log in there and you can actually request an appointment, or you can go to our main number, 425-823-4000.
You ready to go play?
Let's go play.